This video is for our HBS final project. It's over a disease we chose, and we wrote out a case report and made all the different documents over a chosen disease.
Our patient is Anna Jenkins, a 32-year-old businesswoman. Her symptoms began 1 year ago. It was a normal day for Anna. She had just taken her lunch break and decided to try a new burger place around the corner from her work. She got a cheeseburger and thought it tasted a little funny, but shook it off and continued with her day. All is fine until she woke up the next day when she felt unmotivated. She just wanted to stay in bed all day.
When she tried to get up, she kept falling. She was super worried about her lack of coordination, so she decided to go back to bed and try again the next day. When she woke up the next day, she couldn't remember what day it was or what she was supposed to do that day. She continued to fall, and her husband noticed that she was not herself. He decided to take her to the ER.
Anna visited the ER on March 2, 2017. At the ER, an ER nurse got her temperature, blood pressure, and asked about her symptoms. The nurse ran a blood test and determined she was hypoglycemic. The nurse recommended she eat more sugary items or drink juice if she felt faint, and she sent her home. The nurse gave Anna juice and crackers because she diagnosed her with hypoglycemia, and the correct treatment for hypoglycemia would be just to eat and drink, so her blood sugar would go up. The nurse also recommended to take ibuprofen to ease any pain she had and to relieve headaches.
The neurologist agreed with Mr. Jenkins that something was definitely not right with Anna. He decided to rerun Anna's blood, which showed prions in the blood. He also decided to perform a few scans, starting with a CT scan. The CT scan showed contracting of the brain, so he decided to run an MRI and an EEG. An MRI uses radio waves and a magnetic field to create images of the head and body, which especially is helpful considering the neurologist felt that Anna had a brain disorder. The EEG used electrodes to test the brain's electrical activity. Anna's brain had a characteristically abnormal pattern. These all scans came together for the neurologist to be able to diagnose Anna with variant Creutzfeldt-Jakob disorder. Because of Anna's diagnosis, the neurologist prescribed trimipirine and fluphenazine, two different medications to help subside her symptoms. These will help her stay calm and relaxed as her disease passes through her body.
After receiving word from the neurologist about Anna's diagnosis with variant Creutzfeldt-Jacob's disease, they decided that she should meet with an infectious disease doctor to see if she had any recommendations about Anna's treatment. Variant Creutzfeldt-Jakob disease is a degenerative brain disorder that shows dementia-like symptoms but moves much quicker. This disease is transmitted by the consumption of contaminated beef, which ultimately makes it a very rare disease. On average, between 200 and 300 people die from this disease every year. After much consideration, the doctors believed these would be the best options for Anna. She should be hospitalized in the ICU for a couple of days before she should go home, and if the disease worsens, Anna should stay longer. She should be administered medications such as trimipirine, which is an antidepressant, and fluphenazine, which is an antipsychotic. Anna should be admitted to a nursing home for round-the-clock care once her disease becomes worse. Our manikin shows the disease by how the blood vessels are visible in her eyes, and her brain is smaller and smoother, to show the brain was degenerated over time.
Sadly, variant Creutzfeldt-Jakob disease is a fatal disease that no one really can recover from. So Anna passed away after suffering for a few months. After Anna passed away, however, a pathologist was able to analyze Anna's brain and confirm her diagnosis. This analyzation of her brain matter is the only true way to confirm a diagnosis.